I'm Mike Breen, Public Awareness Officer for the American Mathematical Society, and I'm talking with Mac Hyman at Tulane University. And Mac has been telling us about the models for COVID-19. And so, Mac, to start out, can you just give us an overview of the models, describe them?
Well, thanks, Mike. Before I do that, I just really want to say that the mathematicians are playing a role that's more prominent and more in the public eye for this epidemic than we ever have in the past. And, you know, we are becoming a crucial part of the nation in predicting the future, and we have the opportunity to actually use our mathematics to help guide decisions and save lives. And so first, I just want to shout out a thank you to all the people out there that have responded to the epidemic in whatever ways that we can. You know, our models really can help inform policy decisions that will impact on how effectively we can bring this epidemic under control. So in the early epidemics, our models were focused on where the epidemic would go next and how quickly it would spread. Today, it is a pandemic. It's throughout the entire world. And our models are focused more on helping the medical community plan for the future and quantify the effectiveness of the different mitigation efforts. In planning for the future, we particularly need short-term forecasts. How many hospital beds we're going to need, how many ventilators. And the most prominent model for that are called statistical forecasting models. And these models identify trends in the data and extrapolate these trends for short times in the future. And they are by far the best models that we have. The impact of the behavior changes and other what-if questions can be answered with mechanistic transmission models. These models are based on the contacts between individuals that spread the virus from person to person. They also can provide projections in the future, but what they're most useful for is quantifying the relative impact of changes in behavior, of opening, what the impact will be of opening the stores again, of releasing the stay-at-home order. They can also answer questions like when the vaccine is developed, not everyone is going to be able to get the vaccine first. Who should get the vaccine in a prioritized list to save lives and to slow the spread of the virus? So these are the major two types. Okay.
Are there other types?
There are. There's the wisdom of crowds approach, which I can maybe describe, which we have lots of experts kind of predict what will happen in the epidemic. And then we take an average of all these estimates. And then often the average is far better than any particular estimate. So example, this first started up, I think it was in 1906, when Francis Galton, got one of the godfathers of statistics. This goal was to see how this idea would work, guessing the weight of an ox at a county fair. So when the ox was butchered and dressed, how many pounds would it weigh? And he offered a prize. 800 people came and entered the contest and wrote out their tickets. Well, not a single person guessed better than the average of these 800 guesses, which was off by less than 1 pound on a 1,200-pound ox. And so this wisdom of crowds has got a strong statistical underlying basis, but it's not what you typically think of when you talk about forecasting or regression or differential equation models.
It sounds almost, you know, and I'm not I wasn't a statistic major, but it almost sounds like the law of large numbers.
It's exactly what related to the law of large numbers. Okay. Now, I should say that all the mechanistic models and the statistical forecasting models are based on data. And in this model, we have very little of the data that we need. The data we have are the confirmed cases of COVID-19. In fact, what we're really interested in is a completely different question. We want to know how many people are infected. And so it's an independent calculation to take the number of cases that are confirmed and estimate how many people are what's the hidden epidemic? How many people are not being tested? And this goes through a series of calculations because the number of tests that are given changes from day to day, okay? And also the criteria for who will be tested changes. In the early days, you only got tested if you had been to a region that the coronavirus was known to exist. Later, they expanded it until you were sick or showed malaise. And now, as they're testing more and more people, the criteria are getting less and less. And so if we're going to use these confirmed tests to estimate how many people are unconfirmed or have not been confirmed or infected, that's another type of mathematical model. Also, the current tests have a very significant false negative rate. Early on, it was up to 40% that when a positive person was tested, the test would actually say they were negative. So if we're going to use these tests to train our models and to fit parameters in the models, we have a preliminary step on analyzing the data. Now, data scientists know that about 80% of our time is actually spent pre-processing the data. And this exception is absolutely this epidemic is absolutely no exception.
What exactly is a statistical forecasting model? And does it have strengths and weaknesses?
So statistical forecasting models are the bread and butter of our mathematical and statistical society. They're based that the data comes from an underlying trend, which is predictable. And the actual data are variations or random fluctuations about this trend. And these models the goal of these models to estimate the trend, and they're very good at making short-term forecasts, calculating initial growth rates, and quantifying the uncertainty in the prediction based on these assumptions. However, in this epidemic, the underlying mechanisms driving the data has changed. People have changed their behavior. We instituted these stay-at-home orders. We shut down. People started wearing face masks and gloves. And so these have to be built into the statistical model as changes in the mechanism. Now, we don't have masks and gloves in our regression or in our mathematical model. So we have to make assumptions that say when they instituted the stay-at-home order, the rate of spread decreased by, pick a number, 60%. And the models can actually estimate what that prediction is or what that reduction is. So that the models can tell us how effective in the past those changes in behavior were. If we have enough of the trend before the change and we have enough of the trend after, because we don't see the impact of those trends until the cases are tested, till we get confirmed testing. So that's looking back, 8 to 10 or 10 days. In the future, when we lift the stay-at-home order, we don't have data for that. And so to use these models for that prediction, we'll have to estimate if we lift the stay-at-home order, the rate of infection will increase, say 30% from what it is now. And then we'll get a projection. And we'll say, what if it increases 20%? We'll get another projection. So we don't really have a mechanism for how this will happen, but we can see the impact of increasing the transmission rates by different amounts, okay? Now, these extrapolation is very difficult. In fact, predicting the future, forecasting is very difficult, especially if it's about the future. I think Niels Bohr used to love that saying. And these extrapolated trends can be very sensitive to the mathematical formulation used to fit the data. So since the data has noise, if we fit it too closely, we end up with a lot of variation in our future forecast. On the other hand, if we fit the data is too simplistic, we'll bias our predictions and we'll underestimate what the future will be. And so the role that the mathematicians play is this called the bias variance or variance bias trade-off. And we use statistical tests to kind of find out what is the optimal fit to the data and how does this impact the future predictions, okay? Now, they will give uncertainty in the future predictions, but those uncertainties are really have to be qualified. The caveat is the uncertainties are based on the available data and our assumptions of the underlying models. Okay? Now, the good side of these statistical models is they're almost off the shelf. Once the data comes in, we can plug and play and make forecasts very, very quickly. So the early forecasts for the current pandemic were almost all statistical forecasts. And I've got and people worked night and day to give us just those first, especially University of Washington model is a good example. Very quickly, they were able to give our public health workers an idea of what was coming in the future, okay? Now, the problem with them is they can't answer the what if questions. You know, what if everyone started wearing face masks in public buildings, and what if everyone really started obeying the social distancing rule? Or what if only 20% of the people use gloves when shopping in public places? They can't answer these questions. There's no way to plug that into the model. And for those, we need these mechanistic-based or transmission-based models that are far more sophisticated and often developed specific for every single epidemic. So the mechanistic models are based on modeling the social contact network, modeling people. As people have contacts, they can spread the infection. As people may have, not only with each other, but they may have contact with doorknobs, money, tables, and those fomites can spread, okay? And the mechanistic transmission models build a virtual world. At least there are two types. The most complex and probably the most accurate are individual-based or agent-based models. And these can model up to millions of individuals in a city as they go about their daily lives. And these models have been developed over the past decade at half a dozen sites around the country. And they can look at the impact of, say, a parent coming in from a trip infected with the virus, infecting their children go to school, infect others, they go home, infect their parents. We can follow the spread of an epidemic at a micro scale that was almost unimaginable 20 years ago. And so these models can track or predict the spread of the epidemic in a small region, a university, a city, or even throughout a country, okay? But now, they also can account for the effect that any particular transmission is a random event. And so the epidemic we see is just one of many, infinite number of possible epidemics that could have happened. You know, did that first infected person take public transportation to come home from the airport? Or did they not? And so we run these models hundreds or thousands of times to find out all the different ways that this epidemic can spread, okay? And then what we see is we get an expected or the most likely trend for how it will spread, but we also can see how sharp that prediction is, because these distributions of the way it can spread have tails, and often they're very fat tails. Fat tails means that there's some rare events that can happen that aren't that uncommon, that can either cause the epidemic to die out or to spread rapidly. And these models can not only identify the size of those tails, but they can find out what causes the tails. And then help mitigation efforts to try to, at least for the rapidly spreading tail, you find what mitigation can we introduce into our virtual world to keep this rapid spread of the epidemic from happening. And so it may be that we ask people to bring their own disinfectant wipes onto the subway. It could be anything. But these models, because they're at the individual level, we can look at those type of questions, okay? Now the downside of these, the upside of the statistical forecasting model is that a competent statistician and almost with any reason, a laptop computer can start making forecasts. these agent-based models or individual-based models takes tens of programmer years to develop. The current models, like I say, were started in 10 to 15 years ago and have sometimes 30 to 50 programmer years of effort, not only in creating the model, but the software, building the databases, constructing these virtual worlds for the contact networks. Now, the good thing is that the NIH about 20 years ago had the foresight to start funding these efforts. And so when this epidemic hit, we had these codes in place that were developed for the H1N1 novel flu epidemic, that were developed for Ebola, that were developed for SARS-2, the seasonal flu. So many of these large-scale agent-based methods or models were sitting on the shelf, ready to be applied to this epidemic. And perhaps the next time, Mike, we can talk about some of these efforts elsewhere and just what they're doing. Some of the bigger ones are the OPI code, named after J. Robert Oppenheimer at Los Alamos, or the FRED code at University of Pittsburgh, named after Fred Rogers. So there's one at Northeastern, which is another at University of Virginia. So I'd love to be able to talk about some of these efforts, because they're the ones that are really driving the simulations that can help mitigate the spread of this epidemic. In fact, there were a story. So when the H1N1 novel flu epidemic hit, these were the teams that were called the CDC in Atlanta to say, aha, we have a vaccine for this, but it's not going to be ready for everyone. How do we decide how to release the vaccine? Who should get it to have the biggest impact? And so all these different teams ran their models and very quickly came up, well, the healthcare workers should get it first because they come in contact with the cases. And the second, the school children, because the school children can be super spreaders, or at least following that, you start talking about the people that come in contact with a lot of other people, the bus drivers, the clerks, the teachers. But they gave a prioritized list on how the vaccine should be deployed. Now, in hindsight, what these models tell us is completely obvious. But many times, in fact, that's what we learn most from these models. Things that we may not be sure of in foresight, but in hindsight make perfectly good sense. And if it doesn't make sense, then either there's something we don't understand or the model is wrong. And we need to track that down before we actually use the model.
So it's a little bit like when you see a problem solved or an elegant solution, you hit yourself in the forehead and say, oh,
I could have done that. Absolutely right.
Huh.
Now, most of the current papers are in our mathematical community are because these agent-based models are so hard to develop and take so many years. A lot of our mathematical community are developing differential equation models, or sometimes they're called compartmentalized models, systems of ordinary and partial differential equations, where we can put in very simplistic mechanisms for how many contacts a person has, how often they use PPE, protective material. These models are very good for giving, although they're not very good at forecasting or giving projections of the epidemic, they're very good at quantifying the relative effectiveness of, say, different mitigation efforts. They're very good at identifying, they can be put on a network of, say, every node is a city, and the edges between the city are weighted based on the transportation between the cities. They can estimate what patterns it will spread, how quickly it will reach different regions. And so our mathematical community is playing a big role with these differential equation models, trying to clarify just what has been happening and to help guide the large scale models, because these big agent-based models take huge databases and supercomputers to run. The differential equation models, you can run thousands of simulations in minutes on a laptop. And so the two types of models really, and modelers talk back and forth to each other and trading ideas.
We read a lot about the second wave. What happens when we emerge? Do people have any handle on that? Is there anything you can tell us about that?
Well, I can say that the statistical forecasting models, although they're the best models for the short-term forecast, can really tell us nothing about the second wave. The mechanistic transmission-based contact models, though, really can, because we've got past epidemics, the 1918 flu epidemic, the 1957, the 68 flu epidemics, the H1N1 novel flu epidemic in 2009, all had second waves. And the transmission-based models can be validated to try to understand what's happened in the past. Then when we start forecasting this model, we can look at what level of behavior change and other mitigation efforts is needed to keep that second wave from happening. So these transmission-based models, the models, like I say, that took tens of programmer years and millions of dollars to develop, are the tools that we need to be able to predict whether there's going to be a second wave or not. And we are just incredibly fortunate to have some of those tools on the shelf now. Because if we had not had, or if someone in CDC and NIH had not had the foresight to start creating these tools 10 or 15 years ago, we would be left without a trick in the bag.
So that's a good overview, Mac. Is there anything you'd like to add? Anything we missed?
Yeah, a few things. First is that these models aren't crystal balls, and they can be really confusing to interpret. The modeling community likes to compare itself to weather forecasting, only epidemic modeling is a whole lot messier than weather forecasting. Now, good modelers will try and convey the uncertainty and tell you when something is not knowable. And something I've seen, especially in the reporters I've talked to, is they want to keep asking questions until you're willing to give them a definitive answer. These questions, the answers are often unknowable. We don't know when it's going to peak. We don't know how bad it's going to be in the fall. And to give a definitive answer to an unknowable, to a question with an unknowable answer is far worse than no answer at all. Just like having a bad model that gives you the wrong intuition is far worse than having no model at all. So there aren't any certainties at this time, but our community, our mathematical community, is really playing a central role in helping to predict the spread and help mitigate this epidemic and prioritize our efforts. I want to end by saying, do not underestimate the power that mathematics can have in helping to mitigate this epidemic. We have a role to play. We have a role to play nationally and internationally to knowing where this epidemic is going and to help prioritize the allocation of limited resources. Mathematicians have a role locally to play to working with their public health officials who are looking at these forecasts, the statistical forecasts and the transmission model projections and trying to understand what does it mean for what we're doing here. So as mathematicians, we understand that we would never trust a forecast if we don't understand the uncertainties of that forecast as a function of the data and what the assumptions are that went into the forecast and how sensitive are these forecasts to errors or mistakes in the assumptions. We can play that role with our local health officials. And I think if you make the contacts, you'll find that most of them are more than willing, are eager to have a mathematician at the table to help unravel the mysteries of these forecasts that are out there.
So that's very good. Mac, thanks very much. That's Mac Hyman from Tulane University. He's telling us about the different types of models and also the importance of mathematics in helping figure things out. Mac, thanks a lot.
Okay, thank you, Mike. It's been a pleasure.